A national lockdown comes into force in Austria on Monday. The government says the restrictions are essential to contain a devastating surge in COVID-19 infections. Now, thousands of activists, including a large contingent of far-right supporters, have gathered in Vienna in protest at the crackdown. Just under two-thirds of the population are fully vaccinated, one of the lowest rates in Western Europe. Austria will become the first European nation to make vaccinations compulsory from February.
Another lockdown and a vaccine mandate. They might be a tough sell, but these are the tools Austria's Chancellor says will end restrictions once and for all.
Increasing the vaccination rate is our only way to break out of this vicious cycle of viral waves and lockdown discussions for good. We don't want a fifth wave. We don't want a sixth and a seventh wave.
Faced with low vaccination rates and a fourth wave of the virus, Austria has taken drastic action. This lockdown will initially last for 10 days, but it may be extended. Getting the jab will become compulsory from February next year. COVID-19 infections are at their highest level since the pandemic began, and hospitals are once again buckling under the pressure. Not everyone is in agreement with the measures being rolled out across the country.
This is a sign of the complete failure of the federal government. Because of the months they did not act, they are now responsible for the fact that Austrians are once again locked in, both the vaccinated and the unvaccinated. We have also pointed out in the past days that measures like contact restrictions are required, but this lockdown is very harsh and does not differ from 1 year ago.
And some people are unwilling to comply with a vaccine mandate.
Interference with personal rights, that's not good. No, thank you. That is really not acceptable. Everyone has the right to make their own decision. The vaccine mandate is a no-go for me.
With the festive season right around the corner, many Austrians are in no mood to go back to restrictions. But the hope for a normal Christmas is looking more and more like a distant dream.
Let's bring in Meinl-Reisinger Fremut. He's a lawyer and human rights expert. Austria is the first European country to declare a renewed lockdown, the first to mandate vaccines. Why are we seeing these proposals now?
Well, actually, we face a very difficult situation in tackling the pandemic. The numbers, as mentioned before, are extremely high. And it has proven that a lockdown, even a general lockdown, including vaccinated and not vaccinated people, is insufficient to adequately tackle the pandemic and to save people's life.
So you've called compulsory vaccination a political decision. Can you explain that?
Exactly. Exactly. To me, as a human rights lawyer, it is more a political question than a question of human or fundamental rights. Without doubt, the imposition of a legal duty to accept becoming vaccinated amounts to severe interference with human rights, in particular the physical integrity and autonomy of your body. But these human rights are not absolutely protected, meaning that state interference can be justified by pressing social needs, and states are obliged to protect life and public health. So compulsory vaccination is less about protecting people from themselves than from protecting others, in particular vulnerable people, those who are not eligible for vaccination, for instance, due to medical reasons. And the European Court of Human Rights has found quite recently in April that mandatory vaccination can be lawful even outside times of pandemic. The court has stressed that states enjoy a broad margin of appreciation when it comes to healthcare matters, that vaccination is an adequate means to fight diseases resorting to scientific evidence, and that when it comes to striking a fair balance between individual and collective interests, state might prioritize the idea of what the court called social solidarity. So human rights law allowed states to opt for a mandatory vaccination to tackle and fight the pandemic.
Okay, many experts say that in order to curb the infection rate, more people need to be vaccinated. So you agree or not?
I agree. First, being vaccinated reduces the risk of becoming infected. And there is scientific evidence showing that the duration of being infectious is limited. So in any case, it means protecting yourself, but also protecting others. And the higher the number of people vaccinated is, the more difficult will be the transmission of the virus.
Okay.
And we see that hospitals are really struggling. So it is the last resort, also from a human rights perspective. But I think time has come to opt for the last resort solution.
Okay. Thank you very much, Michael Lysander, Fremut, human rights expert.
Thank you very much.
Let's take a look at some developments in the pandemic. Canada has approved the BioNTech-Pfizer vaccine for children aged 5 to 11. Singapore is easing some of its restrictions. Groups of up to 5 vaccinated people can meet starting Monday. And Iraq has received 1.2 million BioNTech-Pfizer doses through the COVAX sharing program.